Welcome back. Last episode, we talked to Laura about competency-based education and simulations. Thank you for your time and listening to part one. So now let's continue our conversations with Laura. I want to know some more. So in terms of your plan implementation, so
Mhm.
I hear that this is a successful process so far. So I
Yeah,
want to
yeah,
know what were the enhancers.
yeah,
Yeah.
yeah. Well, like as I mentioned, really tight teamwork and communication between all of the faculty that were involved, from creating that faculty designed competency checklist to actually creating the simulation itself for the OSCE, ensuring that all of the healthcare simulation standards of best practice were used, from the way that we communicated and being in lockstep with the words and the language that we use to students. You can imagine if you had a bunch of faculty on different pages, not using this sort of same shared mental model and giving students throughout this process different messages or saying different things, you can imagine that you'd be in a mess, right?
Yeah.
and
Yeah.
and that's so important that the faculty was truly in lockstep. We were really supporting each other and making sure that
Right.
we were consistent with everything that was happening along the way, because if not, that creates a mess, and then you start to lose student trust and student
Mhm,
buy-in in the
mhm.
situation. So huge call out to all the faculty who were on the team. That was never the case, and because of it, it was definitely an enhancer, as you asked. And then
Right.
again, the other thing that I would add is the transparency to students all along the process. I think everyone involved did a great job with that as well. And again, that really helped with, even though students, this was new for students and this evaluation process was very different for them, as I had mentioned a few minutes ago. Um, the fact that we were as transparent as possible did indeed help with trust from the students.
Mhm, mhm.
So
Yeah,
that was really key for sure.
right. So I was thinking about that. Well,
Mm-hmm.
we need to have the trust of all health, not stakeholders, so to speak, right?
Yes,
And
right.
our students, for that matter. So what about, and I hate to kind of like point them as barriers, but did you
Yeah.
ever encounter any barriers to implementation? Because I'm sure our listeners was like, so how do you kind of like navigate those, right?
Right, right. And, as we kind of have talked about already, one of the biggest barriers was, like I said before, getting both students and faculty to change their mental models
Mm-hmm.
about evaluation and about iterative learning. Right. And so, competency based education, truly, the true essence of it is about what the learner can show us, what the learner can do, not so basically it's about the output, right? What can they do? Not about what the input is, not about what we're telling them or teaching them, but what they can actually show us. And so identifying strategies for students who may move at different paces within the curriculum requires using different or additional resources for mastery or for competency. And so when student pacing does vary, and making that personalization of their process attainable for them, that can certainly be a barrier. That takes time, that takes resources. When you're thinking about students not all moving through the curriculum or through that continuum at the same time and at the same pace. I love that about competency based education, but it definitely can be a barrier because it is increased time, increased resources
Mm-hmm.
that
Mm-hmm.
need to be applied for iterative learning.
And
And then the
uh-huh.
last thing I would just say is, again, we've said it already, but a barrier can certainly be moving away from that mental model of good, bad, pass, fail way of thinking
Mhm.
about evaluation, both for students and for the faculty as well.
And from what you said, and I don't think it's only going to be in your program that we would encounter the similar barriers, but all across nursing education in
Right.
terms of implementing CBE
Yeah.
and in our traditional, I would say, educational environment of being tied into semesters or terms
Yeah. Right.
or even credits, right? Or the
Yes.
confines of credits. And then the process of development may not be the same for all students. And therefore, what would be that cap that we would put in there in terms, oh, time's up, or are we
Right.
even going to be putting times up in there, are all maybe conversations happening all over the country as well.
Right.
I
Right.
can imagine that. And definitely we're going to be looking forward to your articles later on in terms of these are the barriers and these are potential
Yes.
solutions.
Yes.
I would be excited to hear that from your team eventually.
Yes.
So for you and your program, what are the lessons learned from this experience?
Yeah. Well, so many.
Yeah,
Let me start with the top few, right?
right, right.
Um, the language used to explain competency-based education and evaluation to learners is really important. And, I think you said it before as we were kind of starting out here today was, gosh, we know that competency evaluation is the way to go. And we've got a lot of guidelines through the AACN with the new essentials and the competencies, but I think what we all need to consider is that even with really clear, once we start to develop really clear roadmaps and really clear curriculums based on the essentials, there is indeed a ripple effect of what that actually means for understanding. So there's going to be some increased development needs for faculty and also for students. It's not you just create these roadmaps and hit play. There's a lot of ripple effects about what that means for students' understanding of how this works and how this plays out. So that's the one
Mhm.
thing, is that the language that we use is going to continue to be huge moving forward. Um, it's also essential to emphasize, as we continue to grow in our competency-based education, to students, the importance of students keeping details of their competency-based evaluation experiences confidential from their peers. If you think about students going in for increasingly more simulations or some type of experiential learning where they have to demonstrate their competencies, we have to make sure that the evaluation process is consistent, and that students who do, like, let's say an OSCE a couple of days before another student doesn't share with them the details of the case or the evaluation, preventing obviously undue advantage for students who take OSCEs, a day or so later than other learners. So I think that's also something that we really need to consider with this kind of move to more experiential evaluation.
Mm-hmm. You're right. So a lot of thoughts there in terms of really challenging the traditional or old ways of us educators doing things. And what I get from this conversation in this later part is really the evaluation piece of it, right?
Yeah.
Um, how do we evaluate students? And OSCE and the traditional way we do OSCE, is there a room for change or changes
Right.
or modifications and so on and so forth? So
Yeah.
yeah, and consistency is a huge thing. It's almost similar to us deploying written exams, and how do we make sure that those exam items don't get out and provide
Right.
and do advantage to others. And
Yeah.
it really challenges the validity and reliability of our testing tools. One thing that I'm also thinking as you talk about checklists and evaluation tools would be like, eventually, would we be in nursing education be able to produce like standardized tools
Right.
to measure these
Yes.
competencies that we want for our nursing students to be
Yes.
professional nurses? Because I know that, and well, we're all on the same boat here. We design our own checklist,
Yes.
but then we expect all our graduates to practice in the same professional environment later on.
Right.
So why is there a need for us to have like all different checklists? But I truly understand also variability of curriculum and context and so on and so forth. So eventually
Yeah.
I think the balance, where's the balance there? And
Yeah.
with that, I get to my next questions of, so what are your next steps for your curriculum, for your
Yeah.
recommendations, Can you
Yeah.
like talk a little bit about faculty development and what to consider there? What are
Yeah.
your thoughts on these? Yeah.
Sure. So, assessment and competency-based education, should be planned for the program as a whole, right? So, not just one semester. So, yes, we definitely piloted this sort of SimZones curricular approach across a semester just as a pilot.
Mhm.
But definitely 100%. I see the value and basically the necessity that assessments like this and this sort of curricular roadmap needs to happen across an entire program, not just a semester. This avoids obviously focusing the assessment on just a few competencies in a course, which could lead to potential gaps in assessment,
Right.
gaps in the curriculum, and failure to address development of proficiency across courses and experiences. So I think, the lessons that we learned from this pilot in one semester, we can now begin to extrapolate across all of our semesters in the entire program, and just ensure that basically, I mean, in my vision, you could essentially create a simulation curriculum like the one we did in this semester and every semester, where you start at SimZone 0 and you work the learner up through SimZone 3,
Mhm.
and every semester, all the while keeping in mind that with every semester as you march forward, you kind of level up, right? So you kind of every semester you're sort of starting through the sim zones with the understanding that you're starting at a higher level every time, if that makes sense.
Yeah, yeah, I can imagine what you're saying in terms of, well, you can actually apply the Zim Zones framework, not just for a course, but for the
No,
entire program,
for the
right?
entire
For
program,
the
for the
entire
entire
program.
curriculum.
And in
Right,
essence, I'm also thinking you can actually backward design the entire curriculum as well, right?
right.
So, and then like intersperse your simulations and your OSCEs all throughout the semester and have a broad overview of, okay, and you be able to give that to the students and say, this is our curriculum, this is your
Yes,
curriculum. At the
yes,
end of your program, you're gonna get there, but
yes,
how, right? That would be
yes,
lovely,
exactly,
right?
Raquel. That's
I
what I'm
know,
talking
right?
about.
That would be lovely right there. And the students would like have this one pager of like, oh, where would I be at the end of this
That's right.
program, right? And
Yes,
the essentials, right? So the
yes,
essentials as
right.
end goals of this
That's right.
backward design,
Right. You
right?
you
Yeah.
think about the essentials and you think about the 10 domains and the 8 concepts that you have
Mhm.
to, make sure that your curriculum gets aligned to.
Right.
And, I as I talk to other educators and as we start to think about redesigning curriculum based on the concepts and the domains of these new essentials, one thing I hear a lot from a lot of educators, not just at my institution, but just friends throughout the country, colleagues that I know, is gosh, every one of those domains has competencies and sub-competencies underneath
Mm-hmm.
of them. And how will we ever be able to evaluate each one of those line item sub-competencies? And of course, that's a challenge. And that's definitely
Right.
going to be a
Right.
way that we have to rethink the way we do things. But one of the solutions that I think is that through these kind of experiential simulations at the end of a semester or at the end of
Mm-hmm.
a period of time in a curriculum, my goodness, you can bundle so many of those sub competencies into one simulation. So
Right.
if you do a competency based evaluation at an OSCE at the end of the semester, at the end of the program, there's a lot of those line items of the checklist that can be those sub competencies that you're banging out 10 sub competencies in one experience for students. And I think that's one way we can kind of get a handle on all of these sub competencies is bundling them into these experiential simulations in which students get evaluated in.
And yeah, right. And that shows us the value of simulations in CBE.
Right.
And we're talking about learning, we're talking about evaluation, we're talking about what would be best strategies to do all of these. We're looking at a solution that is being presented to us right now, which is simulation-based education. And really, I think moving forward, it's really about like, well, how about we plot our curriculum according to the Zim zones, right?
Right. Right, right. And
I
and that's
love
what I
that.
love about the sim zones, and that it's also really aligned with, if people, like I said before, if people are familiar with Miller's pyramid of moving through those levels of competency of knows how, shows, and then shows how and does. And so it's like, yeah, we can't expect our students to just go do if we didn't work them through those levels and those zones of learning and of competency. So it's a great framework to really kind of start to organize your thoughts about curricular mapping and getting students ready for competency.
Hmm. Yeah, so I can see you and your program doing a lot more work in the future, right? So, and then finally, one more question. So, what are the student outcomes though of this pilot
Yeah.
project? So I'm curious about that. Yeah.
Yeah. So I'm really excited to talk a little bit about that and share what the student outcomes were. So,
Mhm.
as I told you, it really took us three rounds, if you will, to get all of these 107 learners through this
Mm.
competency-based OSCE. To be like, I'm really excited to share that around 64% of the students, after working through these sim zones and these OSCE prep labs, were competent upon their first summative OSCE.
Mm.
And I can tell you the most kind of critical items that were missed during that first round that would have someone come back and have to do a second OSCE were things like errors in their physical assessment demonstration, errors in safe med administration, and then like communication, like missed parts of like performing an IS-bar or a handoff. But then, so again, of those, 30% of students who didn't reach competency in that first round, they came back, they had some more deliberate practice, and we did another OSCE with them. After that second round, 92% of the
Mm.
entire cohort were competent. And then again, if they weren't, we had them come back. We worked with them, we practiced with them, and they did a third. And by the third round, 100% of that cohort were competent after that continued deliberate practice and their third summative OSCE. And then, as I mentioned, we also did, once they were competent, we had them watch the recording of themselves
Uh-huh.
and had them fill out a reflective worksheet about, asking them questions about clinical judgment questions. What did you notice about your patient? How did you interpret that? What did you do about it? How did you reflect on it? We also asked them questions of, things like, what have they learned about themselves throughout this process? What will you take with you into your future practice? And we really saw three major themes that were identified when we, after we got done reading all of the students' sort of post OSCE reflections. And it really was, they were very proud, which was really cool to see, especially after their apprehension of this whole competency-based journey. They were really proud to watch themselves and see how far they've come when watching their recording. They could see and have a desire to still continue to refine nursing skills. So they could see they still had ways to go in terms of their growth, but were very proud of themselves.
Mhm.
And then lastly, they did see the value in competency-based education.
Mhm.
They saw the value of that iterative process of, this doesn't have to be a one and done. I have to be perfect the first time. I have to get everything right. They started to come around to see the value of that iterative competency-based way of learning. So that was really cool to see, especially after some of the apprehension and some of the difficulty at the beginning of the process with them quite not understanding. Now we're doing what? And how many times can I try to take this OSCE? And, all of those kinds of questions. It was cool to see them all come together in those reflections of like, oh, good, they're getting it. They understand what this process is supposed to be about. And it's really supposed to be about, the optimizing learning for them. So that was cool to
Right,
see.
right. And it's really an effort to shift our students' thinking of valuing learning for learning's sake,
Yes, well said.
rather than a grade, which goes to
Yes.
my next question. And I know I said it's last question, but I just got it. So how will their transcript look like? And I'm just like, oh, what how we're transcript based, a GPA based. So how
Yeah.
will this translate in transcripts?
Well, that's a great question. And I think that's
Uh,
still something that we all need to, in nursing education, kind of make those decisions and decide what that will look like. I mean, I can tell you in our specific example for this pilot, in our program, in our current curriculum, all of their simulation experiences occur sort of under the umbrella of a clinical course. So all their simulations happen in the same course in which they're going out into clinical. And we have a very sort of pass fail kind of evaluation for our clinicals. They don't necessarily get a
mhm.
number grade for their clinical courses. And so for us, it just kind of tied right into that we would
Okay.
just, it was just going to be basically competency for the sake of competency's sake.
Mhm.
And it wouldn't necessarily be tied to a course in which there was a grade in the first place, if that makes
Right,
sense.
right. And eventually I'm imagining that even our courses that are tied to, well, number grades, so to speak, would eventually kind of like shift towards the idea of competency based, because as I listen to you and you're talking about like competency development of that 64%, I'm imagining all of these competencies had to be tied up with prior earlier zones,
That's right. That's
which
right.
required knowledge, right?
That's
And
right.
those basic knowledge are learned in like lecture courses,
In your grade-based courses.
right? In
That's
your
right.
grade-based courses,
Yes.
and therefore we cannot just take it off in simulations without having to kind of like link our students and them realizing that this is not an isolated event of learning. These
Yes.
would be the culmination of all the other courses that I have taken previously. Are,
Yes.
I would
Very well
say,
said.
I know, right? So when we finally get that all together as educators and our students will understand this is not one thing, that's not another thing. These are all in the same, I would say, container, for lack of
Yes.
a word.
Yes.
Uh,
Yeah.
yeah, so exciting times in nursing education, definitely. So, and I'm encouraged to know that many educators like you, Laura, are facing the challenges of transforming nursing education as well, but leveraging these challenges with um, what we have: simulation education, technology, innovations, right? And of course, let's not forget developing the competencies of our faculty as well. So thank you very much for this time today. Yeah.
Yes, absolutely. This was great. I really appreciate the opportunity to share. I think the more that we can share and the more that we can not keep what we're all doing in our own individual institutions quiet, but
Mm-hmm.
rather reach out and share and talk.
Right. Right.
The more we will learn about each other, the more we'll learn about what other tips and tricks that other people are doing. And as you were saying before, like the more that we do this and the more that we share this knowledge, the more we'll be able to get a little bit more consistent in our approaches and kind of start to think about ways that we're not having to recreate the wheel at every institution, but rather kind of learning from each other about what works well and refining those approaches and those methodologies. So, yeah,
Mhm.
and I do in the spirit of that, I do want to share that we have a publication on this entire process currently in press right now. So that'll be hopefully published really soon for people to actually be able to read a little bit more in detail about
Mhm.
basically the chat that you and I just had, Raquel.
Uh-huh.
It
Yeah.
will be
And
published.
and do you have a title that we can search for that
Yes,
article?
yeah. So
Uh-huh.
the title of the article is going to be the SimZone's approach to a competency-based, objective, structured clinical examination, and it's going to be published in Nurse Educator. So
Oh, perfect.
that's
Yeah.
where people can find it shortly. And I also want to do a call out to my co-author,
Yeah,
Nate
yeah.
Hudson. So
Right.
that'll be out there very shortly in Nurse Educator.
Right. And again, kudos to all your team and faculty as well, which
Yes,
uh,
yes,
of
it
course,
truly takes a village. And
right,
I'm
right.
very blessed to have a great village because this makes all the difference in the world when you can be consistent and on the same page. And also, just really honestly, the team that made this happen, not only were we consistent and collaborated well, but people were really excited and passionate
Yeah.
about it as well. And that makes a huge difference. So definitely want, all of the faculty who played a part in this process last spring to know and hear how much it's appreciated and what a huge difference it makes. So.
Right, right. And calling all administrators to make sure our faculty are motivated and passionate about the work that they're doing for nursing education. And so with that, we would like to thank you again for joining us. Until the next episode, and bye for now.
Bye bye.